Hi, I'm Jesper Eugene Olsen, and I'm going to tell you about our most recent study that we have been doing, collaboration between Greek and Danish scientists. And one of the questions we have addressed is this: you have a patient that is undergoing a surgery, and we are talking today about the most severe form of surgery, meaning surgery of more than 2 hours of theater. The problem is, however, that some of these patients, after the surgery, may develop sepsis or other infections and complications due to the surgical intervention, while others are doing just great. And in this study, we asked whether chronic inflammation or the biomarker suPAR can predict which patients will develop complications and which patients will not develop complications. We included 100 patients, and of these, 67 developed complications and 33 did not. Now, we already know today that it is important to have a good idea of whether a patient will develop complications following a surgical intervention. Because if we know this is a patient with a high likelihood of developing complications, then we know that this patient will need resources following the surgical intervention. For instance, ICU or prolonged stay in the hospital, and we have to be aware that this might be a high-risk patient. On the other hand, knowing that a patient will not develop complications can also help us in the planning of not using all these resources afterward, but getting the patients quickly home. Also, some complications may be so severe, resulting in mortality and so on, that we might consider, if we can predict the outcome, to wait with the surgical intervention in case, for instance, a patient will have a high risk of dying following surgery. So what we do today is that we use the American score of anesthesiology, which is an ability to predict outcomes, and also, of course, age and sex and maybe inflammation as CRP. But we had this hypothesis that the level of chronic inflammation, which means measuring suPAR, we basically think that this suPAR biomarker that everybody has in their blood is linked to systemic chronic inflammation. And if you have a lot of suPAR, a lot of chronic inflammation, you are more likely to develop severe complications. And if you have a low suPAR, you are likely to develop low risk or having a good outcome of the surgical intervention. Now, if we use the ASA score that I mentioned before, which is used for predicting of complications, we're actually not very good in predicting complications. So we need something that can enable the surgeons to better pre-plan which patients will have high risk of complications. So we measured suPAR in these 100 patients, and we discovered that suPAR was really a strong predictor of post-operative complications in surgical patients. So actually, if we look at the patients who had, in this case, below 5.5 or 10 nanograms per ml, if we compared patients below 5.5 to patients who had between 5 and 10, we saw that these patients had 11-fold risk increase in complications. And actually, if we compare patients with suPAR above 10 to patients with low level of chronic inflammation, suPAR below 5.5, then we saw a 21-fold increased risk of severe complications. Now, this I think is really interesting, because why is suPAR such a strong marker? And exceeding an algorithm significantly of ASA score, age, sex, and CRP levels in predicting these outcomes is likely because having a high level of chronic inflammation means you're not able to really heal following the intervention, and thereby are more exposed to high risk. suPAR was actually so strong in the prediction, we had an AUC of 0.82, whereas the old algorithm only had in the 0.60s, 0.62. And even combining the ASO score, age, sex, CRP with suPAR was not better than just measuring suPAR. So it's really something that has some ability in predicting outcome for patients. And this can help in the pre-planning of selecting patients. Oh, you have a high suPAR, you have a high risk of complications. We need probably to plan with this. Maybe we can wait. For instance, we did another interesting study. We had some smokers who continued to smoke, and after 3 weeks we saw they had a little increase in suPAR or the same suPAR. But patients who stopped smoking, they decreased by 1 nanogram. And in this study, we actually see that a decrease of 1 nanogram is associated with a 50% lower risk of developing complications. And this was in 3 weeks. So it's a good idea, for instance, to stop smoking before you're undergoing surgery, because that will lower your suPAR, lower your chronic inflammation, and thereby also lower your risk of developing complications following surgery. This paper was published on November 1st in Surgery, and I hope you will enjoy reading it.